Good morning, Mary Burns Coral here to demonstrate a complex wound care where we're going to do a sterile dressing change. We're going to empty a JP and measure the drainage. We're going to do ostomy care after we do the sterile wound care. We're going to empty the ostomy bag, measure the effluent, and change the entire bag. Most of the time, the hospitalized patients, usually when they have a new ostomy, they're not going to look at it, so we have to assist them with the first couple ostomy dressing changes. First of all, I'm going to clean my overbed table as best practice, because you think of all the things that are on overbed tables before I start setting up my sterile field. I'm also going to ID my patient 2 ways, introduce myself. Mr. WCC, I'm going to do a dressing change. That means your surgical site, I'm going to remove the dressing. So I'll explain in simple language to the patient what I'm going to do, ID them, put the bed up to a comfortable level for me so I'm not straining my back. It's usually wise if you know what type of supplies you need, and I did look ahead of time to see what I needed for the supplies for Mr. WCC, so I have everything here. I have clean gloves. I have sterile gloves. I have wide tape, 2-inch tape, and I have narrower tape, 1/2-inch tape. I have some sodium chloride irrigation. I've got sterile tweezers. I've got some protective barrier film. I've got a container to measure the JP drain with, which is usually found in the patient's bathroom. I have a pen. I have my scissors for cutting the ostomy. I have a measuring thing for the ostomy. I have a new ostomy bag and a clamp, and there is 1 clamp for every 5 bags. Usually I have a chucks. I have this to measure my effluent with the ostomy. I have a drain sponge, which is a split sponge. I have a 4x4, and I have an ABD pad. So Mr. WCC, I'm going to do your dressing change. So first of all, I'm going to set up my sterile field. In the sterile field, I can set up right on my sterile gloves. And I have a waste basket down here so I can just drop everything, so I'm not going to have my hands below the table. So I'm just going to demonstrate all the supplies that I'm going to set up. Before I even remove the dressing. It doesn't want to let go. It's still within my 1-inch border, but if you're concerned about that, then you can always go underneath and move it a little bit. It's still within my 1-inch border. And my ABD pad. Okay. I'm going to go ahead and have my tape torn ahead of time. possibly 4 pieces of tape. Have that done ahead of time. I'm going to also tear some tape for securing my JP, just in case I need it. I'm also going to set up my split my gauze pads, not my split 4x4s, I'm sorry. My gauze pads, because these I'm going to pour some sterile irrigating solution on, which is usually saline or sterile water. So got a new bottle, gonna pour it, not to saturation, just light. So I poured some. Okay, now I'm going to wash my hands again, put some clean gloves on, and we're going to look at our patient's abdomen, which I peeked at beforehand because then I knew what supplies I needed to get, and I always will have extra sterile gloves in case I contaminate. I'll always have extra clean gloves with me in my pocket. I'll have extra 4x4s, I'll have extra split sponges, just a few extra so the patient isn't overcharged. You see the ostomy here, we're going to change that later. This JP drain is attached to the abdomen, so I'm going to loosen that, the tape. I want it out of my area so I can empty it a little bit after we're done with the dressing change. I'm going to remove the tape and the dressing, being careful not to pull the drain out because not all drains are sutured in place. So I look at the type of drainage. Take off my split 4x4. And I would record the type of and amount of drainage. If there is any odor, remove my clean gloves, wash my hands. Again, anytime you change gloves, you're going to wash the hands. And apply my sterile gloves. I have everything set up. Note that the glove stuck to the thing. It's not a major thing at all. Step back, put your gloves on. Once they're to here, let it go. Then now I'm okay to move this stuff right here. Find where the thumb is, and you can use whatever type of gloves. If these are not the correct size of gloves for you, then you could put clean gloves in this package, make it your sterile package for doing the checkouts. And this is rather a large cuff. I can straighten out my fingers afterwards, drop, straighten up my fingers, drop. So now I'm set to go. Now I'm going to first take my saline soaked with my tweezers, sterile tweezers, and I'm going to go around the tube site. And drop. Now, I know you've shown how to do it nice and neat. I'm sure what Marjanovic calls it, what's the Chinese thing that you, wonton. She calls it a wonton, and gets it in a nice wonton. and that's perfect and great, but sometimes I'm not as nice and neat as that, I have to be honest. So I'm going to clean it again and making sure that I'm not touching my sterile hand to the drain site at all. I mean, to the tube or anything else. Then this is done. I'm ready to go. I'm going to put my split 4x4s on. I haven't contaminated anything, so now to get this on, it's a little bit tricky. So your JP drain, you want to make sure you can grab underneath if you want to, or you can put it towards you. So I'm just going to drop it. Now, I contaminated on that ostomy bag the tip of my finger, so this hand is no longer good to be used. Okay. And the blue line goes on the outside of the ABD pad. So I'm going to place that on, and I'm done. Now I can tape. So I'll tape my dressing because it's clean from now on. Making sure my ostomy bag is out of the way. Okay. Now I'm going to measure, because my hands are clean, I'm going to measure and empty the JP. Looks full. Okay. Then I'm going to squeeze it, compress, and now it's ready to go again. So I'm going to take that to the bathroom, measure, record as drainage output. I'm also going to use another tape here. To tape this right to the dressing so it doesn't move. The JP. Okay, that's it for the wound care. Now I'll go on and demonstrate the ostomy care. I'm going to remove my gloves and wash my hands.